Good day, I am student nurse Christine Jones-Alce, and today I am going to demonstrate tracheostomy care. So this is a medical procedure that involves an opening on the neck in order to place the tube into a person's windpipe. Tube is inserted through a cut in the neck below the vocal cords, and this allows air to enter the lungs. The purposes of this procedure are to maintain airway patency, to maintain cleanliness and prevent infection at the tracheostomy site, to facilitate healing and prevent skin excoriation around the tracheostomy incision, and to promote comfort. The equipment needed for this procedure are suction materials, tracheostomy care kit or sterile supplies. We have several cotton tip applicator, 2 basins, brush or pipe cleaner, 4x4 gauze pads, and sterile pre-cut tracheostomy dressing. We also have 2 pair sterile gloves of appropriate size, 1 disposable clean gloves, disposable inner cannula that is the same as the tracheostomy if available, normal saline solution. We also have hydrogen peroxide, roll of twill tape or the Velcro tracheostomy holder, bandage scissors, towel or linen pad, overbed table, face shield or mask, and plastic disposable trash bag. First is we have to assess the signs and symptoms of the need to perform tracheostomy care, which includes soil dressing in thighs, secretion in the tracheostomy tube, if there is diminished airflow through the tracheostomy, and in accordance with hospital policy. This is to determine when to do the tracheostomy care. Assess the patient's respiratory status, including the respiratory rate, depth and rhythm, the breath sounds, and the patient's color and pulse oximetry results. This will help determine whether the patient can tolerate tracheostomy care. After that, we will assess the tracheostomy site for any drainage, redness, or swelling. Because drainage, redness, or swelling may indicate infection. And then we will assess the patient for pain. If tracheostomy is new, pain medication may be needed before performing tracheostomy care. And then we will assess the lung sound and oxygen saturation levels. So we have to remember that lung sounds should be equal in all lobes with an oxygen saturation level greater than 93%. And we will inspect the area of the posterior portion of the neck for any signs of skin breakdown that may result from irritation or pressure from the tracheostomy care. This will help prevent skin breakdown caused by irritation of the tracheostomy thigh. Good morning, ma'am. I am student nurse Christine Jones-Alce, your nurse for today. May I know your name, please? Okay, good morning, Miss Pinky. So today I am going to assess your respiratory status. So I'm gonna get the pulse oximeter. Please. Okay. Okay, so based on your result, we are going to perform tracheostomy care. So I'm going to assess your tracheostomy site. So I will be back in a minute and I will perform tracheostomy care. We will now proceed to the planning. So tracheostomy care involves application of the sterile knowledge, sterile technique, and problem solving, and therefore it needs to be performed by a nurse or respiratory therapist. This is to ensure that the procedure is within the scope of the nursing practice. And also, we have to gather all the materials needed to save time and effort and to facilitate smooth implementation of the procedure. We will now proceed to the implementation. So the first thing that we're going to do is to identify the patient to ensure that the intervention is administered to the correct patient. So I've already done that on the assessment. So the patient is Miss Pinky. Next is determine the need for tracheostomy care. So I have already done that on the assessment. So what I'm going to do next is to explain the procedure to my patient. So explanation of the procedure will alleviate the patient's fear. And then I will reassure the patient that I will interrupt the procedure if she indicates respiratory difficulties, because any procedure that compromises respiration is frightening for the patient. So good morning once again, Miss Pinky. So today I'm going to perform tracheostomy care. This procedure will help promote comfort, and this will also prevent infection because we're going to clean your tracheostomy site, and also this will maintain airway patency. So during the procedure, if you feel any pain or discomfort, or if you have difficulty in breathing, don't hesitate to tell me, so you can tap me, so we can pause for a while, and we will continue the procedure if you feel comfortable. So after that, I am going to perform hand hygiene to prevent cross-contamination.
A few inches later.
My hands now are already clean. So the next thing that we're going to do is to adjust the bed to comfortable working position. So I can lower the side rails closer to me. This will facilitate good body mechanics in performing tracheostomy care. So I will adjust the bed. Since my patient is conscious, then I will place my patient in semi-Fowler's position. So for those unconscious patients, they will be placed in a lateral position facing the nurse, and we will place a towel or linen pad over the patient's chest. So positioning my patient in a semi-Fowler's position helps the patient cough and breathe easier. Gravity will also facilitate suction catheter insertion. Next, I will move the overbed table on my working area and place the trash receptacle within easy reach of work area. So the overbed table provides work surface and maintains sterility of objects on surface. After that, I will put on face shield and mask, and I will don sterile gloves. So the PPE prevents contact with contaminants. Mag-suction na po ako, mama. So we're done with the suctioning. The next thing we're going to do is to place the tracheostomy care equipment on the overbed table, and we will prepare the equipment using sterile technique. This will help maintain the sterility of the equipment during tracheostomy care. And preparing the equipment before the beginning of the care ensures efficiency. So we will place the tracheostomy care equipment on the overbed. So we are going to open the tracheostomy care kit, and we will use pickup forceps to arrange the sterile tracheostomy care kit and separate the basins. So we have to remember that this is sterile. We'll now separate the basins. So we have to remember that basins are sterile receptacles for cleaning the solution. So we will also put the sterile cotton applicator on the sterile field. Also, we have to put our 4x4 sterile gauze pads. So after that, we will fill one basin with hydrogen peroxide and another basin with saline solution. So hydrogen peroxide helps remove dry, encrusted secretions. Another basin for normal saline, and saline rinses and removes hydrogen peroxide and lubricates the outer surface of the inner cannula. This is for easier reinsertion. Pipe cleaner is already available on the sterile kit. So brush will provide friction to clean the inner surface of the cannula. So we have opened the 4x4 gauze package, and what we're going to do is to wet one gauze pad on the hydrogen peroxide, and we will also wet another gauze pad with normal saline, and we will keep the third package dry. We will use the third gauze pad to dry the skin around the tracheostomy site after cleaning. So we have already opened the cotton tip applicator packages, and we will wet the applicator in one package with normal saline, and we will also wet another one on the hydrogen peroxide. So I have already prepared and opened the package of Velcro tracheostomy ties, and this will allow to stabilize the tracheostomy tube and prevent from dislodging. We're going to put on disposable clean gloves to protect against exposure to blood and body fluids. So the next thing that we're going to do is we will stabilize the outer cannula and the faceplate of the tracheostomy using one hand, and we will rotate the lock on the inner cannula in a counterclockwise motion with other hand to release it. It is important to stabilize the base plate to prevent trauma to the patient and prevent pain from the stoma. And releasing the lock permits removal of the inner cannula. I will hold the faceplate and I will gently remove the inner cannula, and I will carefully drop it in the hydrogen peroxide later. So, tanggalin ko lang po mga. So, I will gently remove the inner cannula. And I will drop this one in the hydrogen peroxide. So soaking the inner cannula in the hydrogen peroxide will loosen the dry and hardened secretions. So I will put back the oxygen. After that, I will remove the soiled tracheostomy dressing, and I will put it inside my glove, and I will discard it to prevent the spread of microorganisms. Ma'am, excuse me ma'am ha. Tanggalin mo lang po. After that, I will perform hand hygiene to prevent spread of infection. Now, I am going to clean the inner cannula. So, the first thing that we're going to do is to don sterile gloves. And we have to make sure that we will maintain a aseptic technique of the procedure. So I will keep the glove of my dominant hand sterile, and I will handle the sterile supplies with the dominant hand only. So next thing that I'm going to do is to remove the inner cannula from soaking solution using my dominant hand. So this will maintain the sterility of the inner cannula. After that, I will get and moisten the brush cleaner in the saline, and I will insert this brush into the tube using the back and forth motion. Movement of brush creates friction, and it will help remove accumulated secretions. After this, I will immerse the inner cannula in the container of normal saline solution and agitate it until it is rinsed thoroughly. So, immersing the inner cannula in normal saline solution and agitating it will remove the hydrogen peroxide, which can cause tissue irritation and other debris from the inner cannula. So I will immerse the inner cannula. And then I will tap the inner cannula against the side of the container. So, tapping the inner cannula against the side of the container removes the excess fluid, so the patient does not aspirate it when reinserting the cannula. After this, we will remove the oxygen source using my non-dominant hand, and I will reinsert my inner cannula into the patient's tracheostomy in the direction of the curvature. My dominant hand will be sterile, so I will lock the inner cannula in place securely to prevent it from dislodging. So ma'am, ibalik ko na ma'am ha. Relax lang po. Lock the cannula. And I have to make sure that I follow the manufacturer's instruction in locking the cannula. So I have successfully locked the inner cannula and it is now secure. So the next thing that I'm going to do is to reattach the oxygen source because it provides the patient with the need of oxygen and it will prevent oxygen desaturation. After reattaching the oxygen, I will now proceed in cleaning the stoma under the faceplate using a cotton tape applicators. I will saturate the cotton tape applicator with hydrogen peroxide and using a circular motion from the stoma site outward. So I will use each applicator only once and then discard it to prevent contamination of the cleaned area. Ma'am, maglinis ako ma'am ha. After cleaning the stoma, I will now clean the top surface of the faceplate and the skin around it using a gauze pad which is saturated with hydrogen peroxide. And I will use each gauze pads only once and then I will discard it. It will help remove secretions that provides a prime medium for microorganism growth and it will prevent contamination of cleaned area. So I will repeat cleaning the stoma using the cotton tip applicators and I will saturate it with normal saline solution. This will remove the hydrogen peroxide and debris that can irritate the skin. After that, I will dry the skin and outer cannula surface by patting them lightly with the remaining dry gauze pad. This will help prevent skin breakdown and removes moisture, which can promote bacterial growth around the stoma site. After drying the skin and the outer cannula surface, we will now apply a sterile dressing and we will not use 4x4 gauze pad. So we have to use a commercially prepared split gauze tracheostomy dressing. This is to prevent creating a tracheal abscess to the patient. So we will place the dressing under the flange of the tracheostomy tube while applying the dressing. We have to ensure that the tracheostomy tube is surely supported. So excessive movements of the tracheostomy tube irritates the trachea. Let us assume that this is the commercially prepared split gauze tracheostomy dressing. Ma'am, lagay ko lang to ma'am ha. So after applying the sterile dressing, we will now proceed to the changing of the Velcro collar. In changing Velcro collar, we can also ask for assistance to prevent accidental dislodgement of the tracheostomy tube.
We also have one strip method wherein we cut a twill tape of 2.5 times the length needed to go around the client's neck. So we will thread one end of the tape into the slot and tie the loose ends with a square knot at the side of the client's neck. So we will place a folded 4x4 gauze square under the tie knot and apply tape over the knot. This will reduce skin irritation from the knot and prevents confusing the knot with the client's gown ties. In Velcro collar method, we will thread one piece of the collar with the Velcro end into the slot on one side of the flange. And then we will take the collar around the back of the client's neck, keeping it flat, and we will thread the other piece of the collar into the slot on the other side of the flange. So we will check the tightness of the collar as with the tie method. So we also have two strip method or the twill tape. So we have to cut one tape longer than the other to allow them to be fastened at the side of the neck for easy access and to avoid the pressure of a knot on the skin at the back of the neck. After that, we will remove and dispose sterile gloves in the appropriate biohazard receptacle according to agency policy. Proper disposing of used equipment prevent cross-contamination. Then we will perform hand hygiene, document all relevant information, and record suctioning, tracheostomy care, and dressing change, noting the assessments.
Hello, Miss Pinky. I am student nurse Christine. How are you feeling right now, ma'am? Okay, it's good to hear na wala na po kayong breathing difficulty. So, comfortable naman po ba kayo sa position niyo, ma'am? Or do you want me to lower your bed? Okay po. So, if you have any concerns, you may call me. Nandiyan lang po ako sa nurse station. Thank you, ma'am.
Document the date and time that tracheostomy care is performed. Note the condition of the stoma and presence of drainage. You have to note the color, amount, consistency, and odor of secretions. Document respiratory status and note the patient's tolerance of the procedure. And if problem arose, document any intervention that were necessary.